Hi, and welcome to another video from the CTAG Clinic. My name is Dr. Mike Lloyd and I'm the Clinic Director. In today's video, we're going to be looking at a subscriber question, so thank you for Emma for giving us this question. And that was asked as, I wonder if a person has a part that is exhausted, can deliberately or not switch to one that is relaxed and not tired. And this is a great question, Emma, so thank you very much for this. In a way, it comes down to the heart of what we do at the CTAG Clinic in terms of our therapeutic purpose and the approach that we take with all of our work. So when we're looking at actually trying to control or have mastery over the dissociation, so this is particularly true for dissociative identity disorder and other specified dissociative disorder, where internal parts and or alters can manifest and influence, take control of behaviour, and can they move the person between one scenario and another. Now, what we're not necessarily looking at doing is closing all that down. Certainly what we're trying to achieve is to be able to move between those states in a helpful way that is useful and productive in that person's life. So it's quite an advanced technique in some respects to be able to have mastery over that level of dissociation. And for these purposes, as always, highly recommended that this stuff takes place within therapeutic settings. So we don't really recommend that people try this stuff out too much at home. And I'll go through some conditions a bit later on as to what would be needed if you were to do that. But ideally, this is done within the therapeutic context where you have a therapist who knows what they're doing, who can support you and resource you throughout this whole process. What we're trying to achieve then is the knowledge that a position that a person might be in at any one time is not good for them. So it could be a state of heightened fear or anxiety, apprehension, dread, or just generally feeling completely out of sorts. As Emma said, it could be that the part or the person is absolutely exhausted and tired and just needs to take a break from the pressures and stresses of everyday life. And wouldn't it be great if that could then move into a part that was completely and utterly good at dealing with exactly what was going on, but not as a trauma trigger, as a chosen process, so as a decided process of action, that the person would have enough agency to say, I can't deal with this, or this part can't deal with this, there is another that can. If that part can come forward, they'll deal with it a lot better than I can. They can then cope, I can then come back and move on. Now that sounds really wonderful in principle. So we're going to go through some conditions in which case that might be able to take place. So for that kind of dissociation on purpose to happen, I think that there are 5 things. There are going to be more obviously, but I think the 5 things that are needed to be able to do that are as follows. The first is that the person has to know the system. So the way that system is set up has to be pretty well known and fairly organized. Because obviously if you're looking at deciding to bring one alter into a situation, it's important to know which is the one that would work best. So knowing the system is very, very key to this. The second is basically having communication in the first place. If you're going to ask someone for help, they've got to be able to hear you. You've got to know that they're going to respond. There has to be a two-way communicative process, and there has to be some agreement that is in principle okay to do. So building that communication within the stabilization phase, obviously very important. The third is a willingness to collaborate. There may be communication, but it might not be all that helpful and it might not be all that productive. There needs to be some agreement, and this needs to be negotiated over time, that to and fro, that collaboration, you do something to help me, I will do something to help you in return. That collaboration, the reciprocity of that arrangement has already been put together and is in place. The fourth is that there has to be enough stabilization in place so that the person isn't overwhelmed. There's no good trying to have a part come in if that is going to be overwhelming in of itself. For example, the part that comes in brings along with them an awful lot of trauma that then completely takes over. So to call for a part to come in to help in the moment wouldn't be any good if that part brings in a huge amount of emotions that then can overwhelm and make any situation worse. So there has to be a degree of stabilization to know that the part that would come in would be useful and contained within that context to be productive. And I think the last one is that there's an acceptance that it simply might not work, is that you might ask for something to happen and it might just not happen. And there could be many, many reasons why that would be the case. So some degree of acceptance that this might just not work and not to be too worried about that. And I think for that reason, that fifth reason is that this needs to be practiced in a safe and calm arena when there is really nothing going on. I just don't believe that to practice this stuff is at its best when you're in the middle of a really difficult situation. This is why therapy is so good for this, because the therapy context ideally is calm, it's well resourced, it's well contained, and that's ideal for being able to practice this communication, this collaboration, and the movement between one part and another. So it's not being done on an emergency basis, it's being practiced when it's not needed. I think that's really central to this, and that's something that people don't always get right, because they start practicing when they need it, and that's really not going to work very well, so it tends to go wrong, and that can make things worse for the person. So practice this stuff when you don't need to do it is really common sense, and that's really what I recommend. So all we're talking about is to be able to know that there is a part that might be able to help, and to call for help, ask for them to come and help, which can be difficult because a lot of people with trauma don't like asking for help. So to ask an internal part to help, to specifically call them, and to set out the terms and conditions of that. So here's what I want you to do, here's how long I want you to do it for, and I will come back afterwards, and then I'll take my place and we'll just carry on as we were before. So even like setting an alarm on the phone might be useful. It'll be 10 minutes, it'll be 15 minutes, so that it's done in a really organized and structured way. Obviously, that means it's going to be very, very different for every person. So this is a unique, individualistic sort of process. How you ask, who you ask, the nature of that is highly individual. So I'm not going to give any specific, this is how you do it type stuff, because that will work for some people and it will not work for other people. Ideally, this is done again within therapy, and I know not everybody has access to that, but I still got to recommend that this is best practice, to be able to work that with a therapist so that it's tuned to the individual system and structure of that system. That has the best chance of success. And if you just don't think that the conditions are being met, if you just don't think it's a good idea, then please don't do it. I mean, the if in doubt, leave it out principle applies with this. If it seems like this is going to be a good idea, if it feels safe, if you don't have the heebie-jeebies about doing this, if it feels like this is a really good idea and might work and seems safe to do so, by all means give it a go. If it feels like there's too much caution or doubt, or there's worry about this happening or this taking place, best not to try it. Again, do it when you're ready, when you're in the right frame of mind, or you might actually be in a different part of your life, so it might be that now isn't the time to do it. But to at least know in advance that this is something that can be organised and done later in the future. I always think it's really useful that people know what they're capable of achieving within their dissociation, within that DID and OSDD, even if they're not able to do it now, to know that in the future there is the possibility that this can be done, and it can be really, really effective and useful in just being able to cope with all the difficulties that life brings to us. Can be a very hopeful place for people to get to. That's pretty much it. I mean, I think the answer to Emma's question is yes, absolutely. And you could be absolutely exhausted, and you can think that there's a part there that might come out and might want to do something really different, and that when they come back, your level of relaxation might have improved. You can be really stressed, you can be really anxious, you can be really scared, feeling like you're overwhelmed. You can call for a part that likes doing some very simple tasks, behavioral type stuff, crafts, play, really simple. Could be some baking, could be some cooking, could be going for a walk, could be playing with a pet. So, and then after a period of time, that part goes away and you're sort of left with that sense of ease that part has left behind. So yes, absolutely, Emma, this can work. It can be quite complex, but when done well, as with everything, once it's practiced and once it's mastered, this can be quite a simple thing to do. It might seem a million miles away from a lot of people listening or watching this video, but it's not impossible. It is something that we try and get people to achieve so that they gain this control and confidence over the way that they use their dissociation in everyday life. So I very much hope that this has been useful. Please do leave any comments, and obviously we do like the questions, we do like the ideas for future content on this channel. It's great knowing that there are so many people that are pitching in and giving us feedback and giving us ideas on this. It really does make things easier and better for us to work like this. So please do like and subscribe, keep looking out for content, please leave comments, and I will see you for the next video. And in the meantime, please do take great care.